And welcome back. Malaria prevalence in the country has decreased from 8% in 2015 to 6% in 2020. This according to the Kenya Malaria Indicator Survey released earlier today. Now the drop is attributed to constant surveillance and implementation of prevention methods and management of the malaria cases. The survey was conducted by the Divisional National Malaria Program and the Kenya Bureau of National Statistics. Beldin Waliaula has the details.
Kenya Malaria Indicator Survey 2020 gives an in-depth assessment of malaria and anemia prevalence among children in Kenya. According to the report, average Kenyan households are made of 4 people, with around 30% of them being led by women. This means that 1 in 3 families in Kenya is headed by a woman. The report also states that 39% of the Kenyan population is below 15 years of age. When it comes to malaria prevention, around 50% of Kenyan households own at least one treated net. But the positive part is that higher number of women and children are sleeping under treated nets.
There was a 49% ownership of nets, of which in the rural areas the ownership was slightly higher at 52% versus 44% in the urban areas.
Overall, 34% of women aged 15 to 49 years had seen or heard a message about malaria 6 months before the survey, with common sources of information being radio, TV, and billboards. Health workers have also played a role in disseminating information on the disease.
So the prevalence of malaria, of anemia rather, in children aged 6 months to 14 years, and this was defined as a hemoglobin of less than 8 grams per deciliter, again was highest in the lake endemic region, where the malaria burden is highest, and seasonal transmission regions.
Kenya is aiming to eradicate malaria by involving the youth in advocacy messages, together with using the Malaria Council to mobilize resources locally to fund malaria programs.
With all the knowledge and expertise within our institutions of research, KEMRI has actually produced a malaria rapid test kit that was unveiled by the President in July this year. It is undergoing validation. It is scheduled to be launched in December.
When it comes to regional prevalence, Nyanza region is still leading by 19% of malaria cases, followed by the coastal region at 5%.
Malaria remains a big problem, and globally in the year 2019, we registered over 200 million cases and over 400,000 deaths, and 94% of these were in sub-Saharan Africa, Kenya inclusive.
The Kenyan government is working with the local and foreign partners to end malaria infections by 2030. Beldin Waliaula, KTN News.